every day I live that.
Yeah.
Tuesday, I just gave myself permission to live that. Not get, it was great to have a snow day and all that good stuff, Didn't absolutely never got dressed.
Yeah.
It was great. Relaxed,
Yeah.
and just being my daughter had an exceptionally hard time this year, and she's in Georgia.
How old is she?
8.
Right.
It's her little brother,
Yeah.
Called, she's crying, and then
Yeah.
yes, I can. Okay. I can see it. Can we skip some commercials, maybe? Let's just fly right through, Gio. Let's make it a half an hour straight. I can't hear you anymore, by the way. Perfect. Thank you. You good with that? No
Sorry.
breaks.
Um,
I can't hear you. We could. Oh. Okay. Okay, perfect.
is this live or recorded?
Live.
Huh? Good.
Everybody's.
Okay. What's going on?
So they're like, we can't. It's not working. The link's not working. Good evening and welcome to Resolutions for Recovery. See, Commissioner, I changed the name and I forgot. This show is dedicated to the education and empowerment of all people struggling with substance use disorder, the patient as well as their family. And all aspects of the community need to come together to work together. And I am one proud Suffolk County resident to have Police Commissioner Cindy. You are doing a bang-up job.
Thank you.
In the best of ways, I mean that.
I appreciate the support.
Yeah, just the way that you've really changed the dynamics of how we do business here on Long Island. I know that in past years, my neighbors and people would complain that they would call in seeing drug dealing going on, seeing unusual activity, and nothing ever seemed to get done. So tell me the first thing that you did when you came into office.
Sure. So we did a lot of community outreach when my team came in, and we were getting feedback that was exactly what you just articulated. So we wanted to make sure that we developed a system and protocols so that when people made complaints about drug dealing in their community, we responded appropriately. So one of the first things we did was re-engage all of our federal law enforcement partners, including the Drug Enforcement Administration. We have 5 detectives assigned to the DEA. That allowed us to free up some resources within the department to focus on drug dealing in our communities. So we leveraged those federal relationships and resources to target high-level traffickers, and then freed up some assets within the department. We added a whole new team to our narcotics section, so we added assets, and then we pushed some assets down to the precinct level, so we have detectives focused exclusively on drug dealing in their communities. And as you know, we rolled out a new hotline.
Yes.
And that's been extremely popular. It's 631-852-NARC. And folks can call that hotline, remain anonymous, receive cash rewards for tips that lead to arrests.
Oh, awesome.
And it accommodates over 200 foreign languages. And we rolled that out on March 31st, 2016. And we've received over 1,500 tips. So as a result of all of that restructuring, the addition of assets in that hotline, we've been able to dramatically increase our narcotics enforcement. In particular, our narcotics search warrants went up 118% compared to 2015. So we're doing more search warrants, and what that means is we're arresting more drug dealers.
Yes.
We're taking more drugs off the street. We're taking guns off the street too, because in 30% of those search warrants, we're recovering illegal firearms. In fact, we recovered 507 illegal firearms off our streets compared to 333 in 2015. So the increased narcotics enforcement is assisting in other areas as well. We also stood up the Long Island Heroin Task Force.
Yes.
And so what we have there is we have a federally funded drug analyst. I sit on a regional HIDTA team, High Intensity Drug Trafficking Area. It's a program that's out of the White House's Office of Drug Control Policy. And we had Suffolk County received a federally funded drug analyst that looks at all of our overdoses and slices and dices data.
Incredible.
Yeah, it's incredibly useful for law enforcement. And we use that data to target drug dealers who are causing overdoses, or target areas where we see an increase, an uptick in overdoses,
Yes.
or areas that have just experienced more overdoses compared to other areas. And we work hand in hand with Nassau County detectives because, as we all know, addiction and crime and drug dealers, they don't recognize county borders. So
No, they don't stop at Route 110 and
Exactly.
say, oh, better not go to Suffolk.
That's right.
Yeah.
So we're working hand in hand with our partners, and one of the results of that task force was a 20-plus defendant indictment where we charged an individual, a drug dealer, for the first time in New York State's history with manslaughter for causing an overdose. So
yeah.
that's a high priority of ours, and we're not just utilizing that data to go after drug dealers and inform our enforcement. We're also sharing that data with school districts and other community partners. One of the programs we rolled out is in many school districts now. It started in Northport. I was getting a lot of feedback from folks in the education world. I was saying, all schools need evidence-based drug prevention programs, and many folks were saying, yeah, we agree, but there are resource issues, there are time issues. It's hard to have a standalone evidence-based drug prevention program in light of the very rigorous curricula that we have to teach. So we came up with the idea that, well, how about if we push data into the classes or push information into the classes, the regular lesson
Yes.
plan, so you sort of, you kill two birds with one stone.
Absolutely. Daryl St. George from Northport High School does that, and Tammy Walsh.
That's who we're partnering with.
Yes, they do an incredible job.
Yeah.
And why not? That's current events. We should be speaking about it on a daily basis.
Right.
That's how you start to make,
Yep.
societal changes,
Sure.
especially with children.
So in math class, you teach statistics with opioid-related overdose numbers or other drug stats. You teach what effect opioids have on the body in health class.
In biology.
Yep.
Yeah.
So it's a good way to use class time efficiently while raising awareness about the situation at Suffolk County.
And I would venture, and I've said it to my own school district, we don't have time not to teach them. It really is going to screw up your data if you have so many children dying from overdose.
Right.
Or not reaching their full potential because they don't know the side effects of alcohol and marijuana, and parents included in that. We should, everyone needs to get educated on that. The old adage that they're kids will be kids, really needs to go out the window
Right.
in this day and age.
I'm glad you bring up alcohol and marijuana use because, of course, when you're in the midst of an opioid epidemic, a lot of people focus on heroin. And the last thing we want, both healthcare professionals will agree, law enforcement, certainly as commissioner I agree, is don't have the attitude, oh, it's just pot, it's just alcohol, it could be worse, it could be heroin, because as we all know, those are the gateway drugs
Yes.
to heroin. And also we know that children who are exposed to underage drinking and marijuana use in their adolescence are much more likely to develop a substance abuse disorder later in life. So, it's very important that we stay focused not only just on heroin, but on all substances, including alcohol and marijuana. We rolled out the new social host program,
Yes.
which has been effective. We've done several different things. We've rolled out a hotline. It's 631-852-KEGS. It's called Cancel the KEGS hotline. So if you are aware
Excellent.
if you're aware of a party where there's going to be underage drinking, you can call that hotline, remain anonymous, and once we get that information, we'll actually go to the house and knock on the door, and if an adult answers, we'll let them know. We know about a party that's supposed to occur here. If you're aware of it, you better cancel it. And if you're not aware of it, well, you're welcome. We just notified you.
And maybe the outcome out east with that one boy,
Right.
again,
Yeah,
suffering dire consequences there.
right.
Hopefully he'll be, he didn't suffer permanent damage. Thank God he's alive, and hopefully he didn't suffer damage.
Right.
I know we just had another big problem in 100 kids were at a house. Was that Mastic or Mount Sinai or Rocky
I'm not
Point?
sure.
Yeah, that was just recently too. You have to. If you see something, say something.
Right.
You can't just turn your head anymore.
Right, especially with business establishments. If you know that there is a convenience store or a beverage store that's serving minors, let us know. We have a lot of different ways to investigate those facilities and to prosecute those individuals who are serving minors. We've increased the number of arrests at these locations for selling to minors. We're utilizing, informants, we're utilizing surveillance, we're utilizing a lot of techniques that we utilize in regular criminal investigations, and we're targeting these establishments because we're not going to stand for it.
Excellent.
We're not going to allow these places to sell drugs, and alcohol is a drug, to our minors.
Absolutely.
And the more we can prosecute those few who are actually doing it, we really believe that has a significant deterrent effect on the rest of the business community. This is something that most business owners don't do because of moral reasons, and that's a good thing. But many do it to make extra money. They make that bad decision, but if they know that they stand a likelihood of being prosecuted, they'll most likely choose not to do it.
How about if you see people, kids grabbing adults
Right.
as they're walking in?
Yes.
Who gets in trouble then?
The adult could, yes, the adult
Okay.
could be prosecuted. Endangering the welfare of a child, the social host law, all sorts of, there's all sorts of provisions that we could apply. Certainly endangering the welfare of a child comes
Yeah,
to mind.
absolutely.
And that's certainly obviously a tactic that some kids use. And a message to adults, that is just not worth it. You're risking your liberty. We will arrest you if we find out. And it's just,
Now, can I ask you, with the social host law, if there are minors and they're drinking in a house, does that go to child endangerment also?
yeah, depending on the circumstances,
Okay.
absolutely. Sometimes, there's just not the circumstances where we can put together that type of charge.
Okay.
But if it's there, we'll do it.
Okay.
And we just amended the law so that the first violation of the offense is actually a misdemeanor as opposed to a criminal violation. And that is very important. It's not just about penalties, but it also affects our ability to bring those charges because under the criminal procedural law, a police officer can't arrest someone for committing a violation unless he or she personally witnesses it.
Okay.
So now that it's a misdemeanor, we can use traditional investigative measures to prove the charge. So we could use video surveillance, we could use witness statements. So that way, a police officer come onto a scene and everyone scatters and
Yes.
there isn't clear observation of the violation of social hosts. We couldn't bring those charges. So we met with community leaders and school administrators and the Suffolk County Legislature at our request changed that law. So that was a good thing. So now we have more tools in our toolbox to enforce the social host law.
So when you just mentioned school administration, I would love to see that if a coach knows that on a Friday night his underage football team is going to a football party, that something be done that way.
Right.
They're not speaking. Everybody wants to keep those star athletes happy. Well, I think that you need to keep them happy and safe also.
Right.
And we both know from our friend Kim Laube, one night of drinking negates 2 weeks of peak performance training. So,
That's
you're
right.
really saving an injury also.
Right, and that's the type of education, too, that
Yeah.
we need to make sure that our students are hearing. Kim does, obviously, a spectacular job spreading that message. That's an important message, and I think a very effective piece of the message, because athletes who are serious, student athletes who are serious about competing, that would be something that affects their decision-making process.
It should be something, but we have children again. We have kids, right? We have kids that say, that's not going to happen to me. I'm fine.
Right.
I'm good. So, again, we have to interfere with their decision-making process when they're 10,
Right.
not when they're 17.
Right. And interfere, I love that word because, a lot of people, the Suffolk County Police Department has launched a number of initiatives in the last year and a half. And sometimes people will say, well, is that really going to make a difference? Is that really going to make a difference? And first of
Yes.
all, I think it will. And secondly, I'm not in the business of making it easy for people to make bad decisions. I'm in the business of interjecting and interfering and intervening before.
A roadblock.
Yes.
That's it may not make a change today, but 5 years from now, let's measure it. And 10 years from now, we'll measure it and see what the outcome is. It certainly can't not make an impact.
Right.
And if you change the direction of 2 out of 10 people, that's a big change.
Right.
For today, just for today. So I wanted to ask you, because I know that you've been vocal on interviewing overdose victims to get who their dealer is. And if you were going to do the interviewing, that would be great. But not every police officer acts like you. So how would that roll out? How would you want to see that roll out? Because there needs to be a lot of finesse there.
Sure, yeah.
Otherwise, we're going to not have people going to not calling for overdose.
Yeah, I mean, this is something that detectives are trained to do. They are trained to use certain techniques and tone in different circumstances. You don't use the same tone and technique in each case, right? Each case, you have to look at all the different circumstances and adjust your behavior to get what you need under those circumstances. This is, regular intel gathering. We do this all the time, whether it's talking to witnesses, whether it's talking to victims, whether it's talking to perpetrators. And this is taking that sort of traditional model of, trying to elicit intelligence from folks and bringing it to an area that we need to be focused on.
Yes.
And a lot of the intel that we're getting through this new program is actually not from the victims of the overdose. That was one piece of it that the media focused on.
Of course.
Right. But essentially what the program is a field intelligence officer who's a detective or in this instance we're piloting it in the 6th precinct. It happens to be a male. So he's a detective who specializes in gathering intelligence and then disseminating that intelligence to appropriate assets, police officers and detectives. And he's exclusively focused on overdoses.
Okay.
And he's looking at packaging associated with overdoses. He's looking at phone numbers associated with overdoses. He's looking at addresses associated with overdoses. He's looking at drug dealers, whether it's coming from victims' family members, victims, associates, people who just know what's going on in the community. He's looking at all this type of data. He's looking at pawn history of certain individuals. He's looking at everything that's possibly relevant to finding out the source of drugs that are causing overdoses. And the type of intelligence that we're getting now is above and beyond what we typically would get. And it's because we have a person who is exclusively focused.
Yeah.
And whenever you basically tell someone who's competent and extremely good at their job, focus on this one thing and get it done, you get results.
Yes.
So this is a person who's taking all that skill that he has, all that experience that he has in being a detective, and focusing it on trying to curb overdoses. So I'm very optimistic that this program...
Have you seen anything, come from it yet?
Yes, I mean, we've seen lots come from it in terms
Excellent.
of arrests and enforcement. Now, will it have the desired effect of bringing down overdoses? Way too early to tell.
Yeah.
We've had a few weeks in a row where our fatal overdose numbers have dropped. In some areas, our non-fatals have increased. So it's just too early to tell what effect this is going to have, and we need to let it play out,
Yes.
probably at least for several months. But if we do see a sustained effect, positive effect on overdoses, we'll spread this throughout the county. And we started in the 6th because that's where we have the most overdoses.
How are we preparing? Because now, of course, we hear all there is no good batch of heroin. So I hate when people say it must have been a bad batch of heroin. It's a moronic statement as far as I'm concerned. But fentanyl, and certainly carfentanil now, that can be readily absorbed through your skin for your first responders and
Right.
for your police that are first on the scene. How are we going to, do they wear a different type of glove
Right,
now?
so we're training all of our officers as to the dangers of fentanyl and carfentanil. We have not seen any carfentanil in Suffolk County, but obviously we're preparing for it. We've just invested in devices called TruNarc devices, where officers now can test the drug without opening the package. It uses a laser and a type of technology where they can take the bag, put it against the device, and then the device digitally will say what it is. It's amazing. And it's
Wow.
programmed to pick up not just cocaine, heroin, and sort of your more traditional controlled substances, but also your synthetics, whether it's synthetic marijuana or your synthetic opioids. It's an excellent device. They're expensive, so I secured a grant. I purchased two, and I have one in the field with officers, and I have one with the narcotics section. And
That's amazing.
yeah, it's a great device, and we're looking to expand it. It's something that I'm going to be talking to my federal electeds, my state electeds, to see if we can get some funding to get some more of those, devices.
You need any help? I'm a good advocate. I'll go to.
I'll let you know, because
I'll go to
it's
bat
not only
for you.
it's clearly ensures it increases officer safety.
Absolutely.
We've seen reports across the country where officers have gotten sick
Yeah.
from opening up a bag, and the fentanyl just goes into the air. They inhale it, they get sick. So it's good for officer safety. It also is good for evidentiary purposes, because you don't have the officer tampering essentially with the evidence.
Absolutely. No.
And then it also it saves resources, because if it comes back, sometimes it's just cut. It's not a controlled substance. It's just cut, and every once in a while it's sugar.
But you have the answer right then
exactly.
and there.
So then you don't send it to the lab, because typically
Correct.
what you would do is you would send it to the lab, and then the lab wastes time testing it. So the TruNarc device would obviate the need to send it to the lab.
That's incredible. That's great. Let's talk about synthetic marijuana, because I don't think we talk enough about.
Right.
Because I know way too many parents throughout New York State that have kids either in a vegetative state, psychotic state, and or have passed from one time using a synthetic marijuana or any of the synthetic drugs. How prevalent is that on Long Island right now?
Yeah, we see a lot of synthetics. First of all, marijuana generally, THC levels in marijuana these days are
Through
much
the roof.
higher
Yeah.
than they used to be. So that's an issue that parents should be aware of. All marijuana use obviously is problematic, but the marijuana that's typically being sold in Suffolk County today and throughout this country is very potent.
It's really genetically engineered now. It's not grown in the soil anymore.
Right.
It really
Yeah,
is
that's right.
much beyond that.
Right. And we've taken down a few grow houses here in
Yeah.
Suffolk County. And then you have your synthetics, K2, Spice, they go by a variety of different names, and you don't know what you're getting with those.
No.
Those are typically manufactured in other countries. It's typically they'll take vegetative matter and they'll spray a chemical on it. Okay, so think about that.
Yeah.
Right, they take some type of vegetation, God knows what that is, by the way.
Yeah, right.
And then they take a chemical in a spray can and spray the vegetative matter, and that's what you're smoking. And sometimes the effect mimics not just marijuana, but ecstasy, cocaine, all sorts of different drugs. And so you don't know what you're taking. You don't know what the effect is going to be. And we've had some sad stories with synthetics
Yeah.
throughout the country. Bath salt is another
Is
example.
another example.
I was
yeah.
actually the first federal prosecutor to bring a case involving bath salts. We went after the head shops in New York City. They were selling bath salts, and there was no, bath salts weren't a controlled substance, and they still may not be. I'm not sure about that, but when I prosecuted, they weren't. So we had to come up with a legal theory as to how to prosecute this. So we had two theories. One was a Food and Drug Act violation because they had stamped on the package "not for human consumption," which is mislabeling.
Correct.
So we went, and then we had undercovers go in, and the undercovers would say, "Hey, what do you do with this stuff?" And the clerk would say, "Oh, you snort it, you can smoke it, you could burn it down and inject it." So they were clearly
Violating
right.
that.
So, but then we also had a much better, stronger theory in terms of penalties was the Controlled Substance Analog Act. So we had to show there's a statute essentially in federal law that says if you can show that the drug is being sold for the purposes of mimicking the effects of a listed controlled substance like cocaine, and the drug is in fact molecularly similar to a banned substance, then you can treat it as if it were a banned substance.
Excellent.
Yeah, so we used that, and we brought a federal indictment against numerous individuals operating head shops and selling the bath salts. So we see that out here, and we crack down on that.
See, there's so much that parents need to be aware of, what their kids can be getting into right in their own neighborhoods, right under the counter at their gas station. You don't know what you really have to have these conversations.
Right,
with
and
them.
some of these are new threats, so
Yeah.
you can't rely on your life experience because when you were growing up, this stuff wasn't around.
No.
You know,
How do you feel about vape pens?
so we view this as an emerging public health issue.
Yes.
There's still a lot unknown about the substances and the physical effects, the long-term physical effects. But certainly, we want to make sure that minors are not being served at these
Yes.
vape stores.
Well, you know as well as I do that they're dabbing in those vape pens. They're
Right.
not
Right.
smoking the flavored oil.
Yep.
So
Yeah, there's no question.
it's a big concern.
Yep.
And as you said, THC is 90%. It can be when you're talking about dabbing.
Right.
So it's crazy.
Yeah, and I would ask residents to seriously think about what type of stores do you want in your community.
Yes.
And if there's an opportunity to have a discussion with your local legislators about zoning and different ways to perhaps keep some of these stores out of your community, you should be doing that. No one wants to have a liquor store on every single corner. This is no different. We're seeing these stores pop up left and right, and it's not the message we want to be sending to our kids.
No, it isn't. And any parent, quite frankly, that says, "I'm okay, my kid's only smoking pot," really needs to get an education on what they're actually smoking, because it's not okay. And then you can't expect your son or your daughter to go on and really fulfill their greatest potential as far as coming out of high school, as coming out of college, because they will suffer some lasting damage from that. I don't think that people really understand how it affects the brain. So come out to the community forums. Certainly, we have all the resources here on Long Island
Right.
now.
Yeah, we do. And, there is a great prevention community, as you know, in
Yes.
Suffolk County. They're doing tremendous work. We recently had a meeting in my office where we're going to come up with ways to strategically persuade organizations to launch evidence-based prevention programs like our schools. And look, a lot of schools have great programs already, but many
Boy
don't.
Scouts, Girl Scouts, all of those.
Yep.
Religious education. Everyone needs to come together. Everyone needs to come together. We only have, we're going to have to cut our show short tonight because you have to, fight crime tonight.
Yes.
So I know you will come back.
Absolutely.
So what would your message be for the springtime that we're going to be coming into eventually, hopefully?
So springtime, obviously, we're talking about proms, we're talking about
Yes.
Graduation parties and barbecues. So just be vigilant. Let's not tolerate underage drinking, marijuana smoking. Let's keep an eye out, look out for your neighbor, and any way you can partner with the Suffolk County Police Department, we're here for you.
Thank you, Tim. Have a great week. We'll see you next Thursday.